What's the most common surgery in general in the U.S., and then what's the most common surgery in your practice?
Excellent. The most common surgery is still liposuction, and things have changed a lot with that. There's a lot of technology now that uses lasers to help the skin shrink, but in my practice it's breast augmentation. So the thing that's really dropped off the charts is facelifting. It's expensive, it's a lot of downtime, and it's tough to convince people to have a facelift when there's so many things like fillers and Botox that can do the job. It's definitely not a substitute for a facelift, but they do a great job in staving off surgery.
The question is, have you seen the age range go lower and lower in his practice?
Not a whole lot. I think with breast augmentation, there's certainly people in their teens who want it, but the federal government has set guidelines that you can't do breast augmentation under the age of 18, and if you're using silicone gel implants, you have to be 22. Now, on the West Coast, there are people in their 30s and 40s having facelifts, but in central New Jersey, people really hold off until their 50s and 60s. But it really spans the age bracket. Certainly people who are older, having kids at an older age, they're having their tummy tucks and breast lifts at an older age now.
No, I was just going to ask, what is the single most horrible thing we're doing to ourselves that requires facelifts or rejuviderms and fillers?
Most of what is happening with someone's face and aging is not anything you're doing consciously. It's simply the aging process and genetics. There are people who simply have excellent skin, depending on someone's ethnicity, so you can be 60 and not have a wrinkle on your face. People from Northern Europe, for instance, wrinkle more, and they'd be more inclined to need something. And obviously smoking can be disastrous, and people in their 30s can look like they're 60. So that's probably the single biggest thing, and obviously sun damage.
Brow lift, Gary, that's what we were talking about.
Well, a brow lift is a procedure that's not considered a lot, and it should be. Oftentimes people have eyelid surgery when the real problem was their brow. Now, years ago, the standard incision was going across the top of the scalp. It was a fairly big incision. Then people went to endoscopic techniques, which is a lot of small incisions, but the results were not long-lasting, and it was a very artificial lift, where the central brow was lifted up. So people are going back to that incision across the top of the head. Now, the problem is if someone doesn't have a good hairline or thick hair, it can be a problem. And obviously in a man with a receding hairline, you wouldn't want to do it.
Is that considered a facelift?
Oh, no, that's separate. No, it's often done with a facelift and eyelid surgery, but it'd be separate.
Women considering surgery, what are the top 3 things to consider before committing to the surgery?
I'll say there's really 2 things. Who's doing the surgery and where's it being done? Now, the problem with a lot of procedures, they're not done by plastic surgeons. It depends on the state and the licensing. But a lot of plastic surgery is not done by board-certified plastic surgeons. Now, depending on the procedure, eyelid surgery may be done by an ophthalmologist, and they'll do it well. Rhinoplasty, nose surgery, may be done by an ear, nose, and throat surgeon. But what we're seeing nowadays are people who aren't even surgeons doing liposuction, doing things that have a lot of risk to them. So you want to look at someone's credentials, and the most important thing is to make sure they're able to do something in a hospital in addition to their office. And most cosmetic surgery is now done in people's offices. So you want to check their credentials. The other thing is you want to see where your surgery is being done. Like I was talking about office-based surgery, you want to make sure it's accredited, and you want to know who's giving your anesthesia, because there have been a lot of disasters of late. There was a woman who died having liposuction. It was in a spa in Western Florida in the last 6 months. So you have to be very careful about the setting of the surgery. This was being done by an internist doing liposuction. Again, there was nothing illegal about it, but you can run into problems. And those are 2 most important things.
I'll add a third. Check your insurance, because sometimes the insurance covers the physician but does not cover the facility.
Actually, and one more thing. When we sit down for a consultation, we always show people our results, and usually they're our best results. But you should always ask the surgeon to talk to some patients. You don't have to identify yourself by name, but every surgeon has people in their practice who are more than willing to talk about their surgery, so talk to someone who's had the same operation, and that goes a long way to finding something about the post-operative course and how easy the surgery was.
Any way to find out if they're bad? I mean, can you go online? Are there sites? other than awfulplasticsurgery.com, which is a great site. It's so much fun.
There are loads of sites, and actually we were talking in our plastic surgery meeting today about some people who've really been badmouthed and the legal recourse, and there's not much because it's the First Amendment. So there are all too many sites now talking about bad results. So it's important to pick one's patients wisely and hopefully not have bad results.
Dr. Gary Smotrich, we are so honored to have you come and join us, and thank you so much for coming to Modern Salon TV. It's such a pleasure to have you here, and next time we're going skiing. We're going back to Aspen. That's where we met. So 30 years ago-ish, 30, 28, whatever, a long time ago. Now he said 80 years ago. Thanks, Gary. Thank you for coming.
My pleasure. Thanks, Maggie.